Leader Jeffries, we just heard a fairly passionate condemnation of the Affordable Care Act. You've been here a little longer than I have. Have our Republican colleagues ever been able to produce a plan that would provide the kind of coverage for Americans, affordable coverage, that the Affordable Care Act did?
You know, it's very interesting that my colleague from Texas wanted to sit there and lecture both Catherine Clark and I, but couldn't see fit to ask us a single question, engage in a debate. Where y'all been, bro? You've been out for 7 weeks. You don't have the time to have a back and forth? We hear you rant for a few minutes, basically threaten to repeal the Affordable Care Act and then don't want to defend that position? You should feel free to defend that position. You've done it 70 times. And if you think that's on the right side of the American people, then fine. That's your plan. Repeal and displace tens of millions of people. That's the Republican plan. And what I don't understand is why my colleague cut and run. I'm sitting right here. Catherine Clark is right here. Hopefully, Madam Chair, we can have a back and forth as opposed to just being lectured to by our Republican colleagues. But I thank the distinguished gentlelady from the Commonwealth of Pennsylvania, who, by the way, another decisive win for the American people in Pennsylvania. Last Tuesday, it was extraordinary rebuke of the extremism that we've seen from our Republican colleagues and the absence of any plan to make life better for everyday Americans.
I appreciate that, and I appreciate your prior remarks regarding what we could have been doing in the House over the last few months. I mean, the Senate's taken some votes on tariffs. Maybe we could have done something with respect to tariffs here. Except I think we have a rule that would prevent us from doing votes on tariffs.
Yeah, I thank the gentlelady for raising the tariff issue because there's so many parts of the parade of horribles that Republicans have unleashed on everyday Americans that I neglected to actually mention the tariffs. The Trump tariffs are causing costs on everyday Americans to increase by thousands of dollars per year. This is an affirmative effort to make life more expensive for the American people. My colleague from Texas, before he cut and run, he also said that, you know, we have a fiscally irresponsible situation in this country and that because Democrats want to extend the Affordable Care Act tax credits for everyday Americans, working class Americans, and middle class Americans, somehow that's problematic. You know what's problematic? The fact that Republicans, with the one big ugly bill, enacted the largest cut to Medicaid in American history, ripped health care away from millions of folks. In that same piece of legislation, cut $186 billion from SNAP, the largest cut to nutritional assistance in American history, literally stole food from the mouths of hungry children, seniors, and veterans. And all of that was done to enact massive permanent tax breaks for GOP billionaire donors. And in the process, as if that wasn't bad enough, skyrocketed the debt by trillions of dollars more per year, saddling our children and our grandchildren and making it more complicated for them to experience the American dream in their future. So we are not going to be lectured by anyone on the other side of the aisle about fiscal responsibility when the bill that you just passed jammed down the throats of the American people in a partisan way because Donald Trump ordered you to do it is the most fiscally irresponsible piece of legislation ever in this country's history.
Thank you. Whip Clark, like you, when I've been in the district and not in DC at the hearings we've been having here, I've been meeting with constituents. Last week, I had an open house and a lunch for our federal workers. It was really interesting because I had 3 federal workers drive over an hour to my district from one of our Republican colleagues' districts because they'd been unable to have any kind of dialogue with him. I came into Congress during the first Trump shutdown. And what has been so remarkable this time around is hearing federal workers saying, yes, this is painful, but what is happening to our federal workforce, the cuts that are happening, the pain that is being inflicted on the workforce is so bad that we need you to hold out. We need you to make this situation better. So between the veterans at the parade I went to this morning in my district, who said, keep fighting, this is not working for my family, and the families who are sending me the comparisons between last year and this year's health insurance, and they were paying $1,600 a month, and now they're going to be paying $600 more a month for a family of 4. I mean, the individual stories are just astonishing. I assume you're having a similar experience.
Thank you. And thank you for bringing the American people into this. I'm surprised to hear my colleague from Texas having a new interest in taking on insurance companies. Where have those discussions been? Where are the plans? Where's the answer to a witness who came and talked over the last 5 weeks to Mariah Plant from West Virginia, who told us about her brother who has special needs, who needs a lot of care, but who she is committed to keeping at home and being with people that he loves. Without Medicaid, she cannot care for him. He is a very medically complicated person, and she is so afraid of what is going to happen. And she, 29 years old, is also a small business owner while caring for her brother full time. ACA is what gets her health insurance coverage. This plan, and let's not sell the Republicans short, they had a plan. Their plan was to come in, take $1 trillion out of Medicaid, trigger a $500 billion cut to Medicare, take away the ACA tax subsidies, and then cut medical research. So while we take it away from people in the immediate and now, we are also saying to the future, good luck. As one researcher who recently lost her lab due to federal funding cuts under the big ugly bill said to me, all the hopes of the patients I've been working with are now in a freezer. Now in a freezer. She said, I'll be okay. I'll be able to relocate, probably to Europe, to be able to continue her research. But that plan that they have is to take all of that funding and give it to the very wealthiest Americans in a permanent tax break. And they couldn't wait to get us back here. We had to come back on July 3rd to make sure that we did that in time. But we've sat here for 54 days without a single hearing, a single negotiation, a single offer, and the one most moderate of proposals to have a 1-year extension and a bipartisan commission to look at ways we can work on this system and make healthcare work for people, rejected, out of hand, and no comment. And I just want to say that it's a little hard to be lectured to about the pain that is being inflicted on the American people when we have heard nothing from our Republican colleagues as this administration saw their shutdown as an opportunity to fire another additional 4,000 plus federal workers to the 200,000 they have already let go, to threaten furloughed federal workers they might not get their pay after this shutdown concludes. Where was the outrage? And going on and lecturing our air traffic controllers that somehow they're not patriotic enough to be working without pay. And then we just go through the parade of horribles on the split screen. People so concerned Their spouse may not be able to have the cancer treatment continue they need. They may not be able to manage their diabetes, get that inhaler that their child needs, and the continuing medical care to survive. And nothing, as the president takes down the East Wing to build a ballroom, hosts a Great Gatsby party with a burlesque show thrown in, $40 billion to bail out Argentina. And then we get to SNAP, where this president and the loyalists in Congress sat on their hands and made up excuses. Well, they took food away from hungry kids, seniors, veterans, disabled people, and said, we legally can't give this out. They knew that was not true then, and they have taken it all the way to the Supreme Court in order not to feed hungry kids. It went from let them eat cake to let them eat nothing. How dare you lecture us when you are willing to let hunger in this country be a political weapon?
Thank you. I will yield back.
Thank you, Ms. Scanlon. Mr. Scott, you're recognized.
Thank you, Madam Chair. And would you agree with me that the gross premium is set by the insurance carrier and doesn't have anything to do with the subsidy?
Who are you asking that question to?
Either one of you.
Gross
Premium.
What I'll say is that tens of millions of Americans are at risk right now of their premiums, copays, and deductibles dramatically increasing because of the Republican refusal to extend the Affordable Care Act tax credits. And these are people all across the country. In fact, in the 10 states that would be most impacted by the Republican refusal to extend the Affordable Care Act tax credits, all 10 of them are run by Republicans.
Mr. Jeffries, if I may.
We're talking about West Virginia.
I'm going to reclaim my time. I wasn't trying to be smart with the question. I'm going to just read from KFF, which I think most of us who study healthcare use KFF. And by the way, I was an insurance broker for 20 years. I've got 4 professional designations in employee benefits. I don't have them anymore, but I had them when I was in business. And my degree is actually risk management and insurance. My father was a surgeon, so I actually saw all sides of it, and I live in rural America. And if you want to talk about rural health care, one of the key issues that we could fix is there are 425 hospitals in urban areas today that claim rural status. So when we put money out there for rural hospitals, the urban hospitals step in and they take that money. In 2017, there were 3. Today, there are 425. So there's a lot of gamesmanship in the system. But according to KFF, and we can get rid of PBMs, there are a lot of things. There's a lot of agreement on how to reduce the cost of health care that I'm baffled that 90% of members of Congress would get rid of PBMs, and yet we can't get that passed and signed into law. But the gross premium, just for the American citizens watching, and I wasn't trying to ask a trick question, Mr. Jeffries, the gross premium is going up 26%. That is what the insurance companies on average are raising their premiums from 2025 to 2026. Now, certainly if the subsidies go away, you're going to see a bigger share of the premium. But the American citizens that are covered under the Affordable Care Act aren't paying the gross premium. They're paying the gross premium minus the subsidy. So there's, I mean, if we're honest, the biggest part of the rate increase is coming from the insurance companies going up 26%. Their costs didn't go up 26%. I don't want to get into a debate. I wasn't trying to be smart. I'm just telling you, if you want solutions, there's solutions, but the solution comes in two areas. One, dropping the cost of healthcare in the country by getting the middlemen like PBMs out. 2 is you got to put competition back into the insurance industry, which means you're going to have to allow some smaller companies in that aren't big enough to do business nationwide. And you're going to have to give the American consumer the option to change plans and not be stuck with the plan they buy January 1. The thing I've never understood about what y'all did when y'all wrote the Affordable Care Act is when you buy your contract January 1, if it doesn't work for you, you got to stick with it for another 12 months. I mean, you should have any system that's going to work will have more insurance carriers with more competition and portability for the consumer so that they can move from carrier to carrier. We did it with no loss, no gain in the mid-90s. No loss, no gain was the provisions that we put in so that we stopped the carriers from games they were playing, however you want to put it. We stopped the carriers from doing a lot of things they were doing with no loss, no gain. There are a lot of things that can be done to fix it, but what you can't do is pretend that the Affordable Care Act works. It just doesn't. It's going to have to be rewritten.
Well, Representative Scott,
when you get serious about rewriting
Yeah.
this, Jeffries, I promise you,
Well-
there's a lot of us that'll work with you.
well, I appreciate your observations, and I will say, listen, we agree on this side of the aisle that we need PBM reform. In fact, there was an agreement to engage in aggressive PBM reform
was.
until Donald Trump and Elon Musk killed that agreement.
It was actually
In
Mr.
December.
Musk.
Well, you know,
It's not elected.
It
Right,
was actually Musk that was posted.
well,
about it.
whoever it was, Republicans apparently decided to pull the plug on that PBM reform. So we agree.
But Mr. Jeffries, you're from New York, correct?
That's right.
So I'm from Georgia. So I trust the Georgia state legislature to determine what our no loss, no gain, or pre-existing conditions clauses and portability options should be. And so that's one of the things as we go forward that we'll be pushing for is flexibility at the states. I'll yield. It's getting late, but thank you for your time.